Hi guys, thanks for watching. Today I want to do a drill with me series where I do some of my diamond painting, and I showed you in the beginning what the painting is, and I just pretty much started about 2 days ago, and I just did this corner here. So now I'm working on this section, and this is the first panel of the painting. So I think this is a 95 by 55 waterfall scene. I'll put the picture in to show you where we are. And I wanted to I love watching people's drill with me videos, so I wanted to do one of my own. Please forgive my voice. I'm just coming back from having strep throat, so I just have to speak low. You should be able to hear me. But anyway, I like watching other people's drill with me videos, so I wanted to make one of my own. And what I normally do is sit around with my daughters, and we do our little crafts and talk about, you know, crazy things that's happened to me in the course of the day, and they love hearing my stories. So they say, "Oh, tell your nursing stories when you do the diamond painting video." So I figured I'd tell a couple of my crazier stories. Just a brief overview about me. My name is Lavette, and I'm 45 years old. I've been a registered nurse for 21 and a half years, and I worked in every specialty area, from home visiting nurse to ICU to the ER, in the last 21 and a half years. So now I work for a major pharmaceutical company. So that's my full-time job anyway. I work in a medical information line in a call center. So I speak to doctors and pharmacists and nurses and patients over the phone, giving information on our medications. But I do have a side job where I still work in patient care. I work as a nurse and supervisor on a unit. So still getting those stories. They're still rolling in, but I wanted to go back and pick a specialty area and focus kind of on some funny, crazy, horror, whatever type of stories in that area. So I'm gonna do some home care stories today. I don't know how long it's gonna take me, but I will try not to have this video be too long. But I'm gonna do some home care stories, and some of them may be a little gross, I would say. Nothing too vulgar or anything like that. But some of them, I'll put a disclaimer, and I'll save the one in particular I'm thinking about. I'll save that to the end, and I'll warn you before I say anything that might not be for the squeamish. So here we go. I'm gonna get set up. I have everything I need. I have my coffee. I don't know if you can see that. My coffee. I don't have my snack because I'm not gonna eat. I'm gonna be talking, but that's okay. I have my drills. I made a big tray, and then I had the little trays, and I work with several colors at a time. Just like doing this one section, and I only use a 4-placer. I usually will just put the letter or symbol I'm working with, so I don't get confused. So like J's are here, C's are here, and but I always work out of my main big tray, and I use my 4-placer only. I'm not into the whole pen frenzy yet. I'm sure I'll get there, but right now I only use a 4-placer, and I'll use them, as you'll see, to place 1, 2, 3, or 4 drills. I do use the single N as well, but I mainly use that. I think I have everything I need. Actually, I'm missing my wax, so I'm gonna, oh, here it is. I have my wax, so I have everything I need, and I have my kit of diamonds. Let me just show that. So this is my kit all labeled up, and and I am going to begin. All right. So, gotta put on my trusty readers. Can't see. Crap. I have the fuzzy 40s as my eye doctor told me. So, got my readers on. I think I was in the middle of a color when I stopped last night. So, I'm going to continue with that one. And the first story I'm going to tell you about, of course, I'm going to be very careful to omit any patient identifying information. So it'll just be a man, and that's all that's needed to know for the purpose of this story. It was a male patient, and so in home care, what we do is we go in, first visit, we assess the patient's situation, check their hospital discharge instructions. When they first come home from the hospital, we go in, we check the medications, we check whatever we have to do for them, and we make a plan for their home care episode, it's called, and we, basically just do what we have to do, and we set a plan for how often we're going to come back. Sometimes we have patients with extensive wounds that require a nurse to come out every single day. And in cases like that, we usually will ask to teach the patient how to do their own so they can do it in between visit days, or we'll teach a family member how to do it so they can take over on it in between, so we don't have to send out a nurse every single day. But in this case, it was a man who had we are given the hospital records with some basic information on the case. So I really just briefly looked over his records. I didn't know a whole lot about his story when I got there. But I got to this home, was escorted up to the bedroom by his wife. And the patient was laying in bed. I'd say maybe 50s, pretty young patient. And he had a wound, a rectal wound, and he had some surgical procedure done on it. And so my main objective with him was actually going to be wound care. So knowing it was a rectal wound, I figured teaching him was pretty much out of the question. So I was gonna, see about the wife doing learning the wound care. That's what I had in mind walking in. Okay, so I'm in this man's house. The wife takes me upstairs. I get upstairs to the bedroom. Man's laying in the bed, facing outward. Like not facing toward the inside of the bed, facing toward the outside of the bed. And then in the bed laying next to him, excuse me, is a broken chair. A chair in several pieces, laid out throughout the whole length of the bed. Like where the partner would sleep, the chair pieces were laid out in it. So, okay, that's already strange, but I'm like, okay, whatever. He sleeps with his chair, broken chair, okay, whatever. So, wife is, not the friendliest of people, but she, shows me where he is, and then she goes on and does her own thing somewhere else. So, I kind of, wanted her to stick around. Usually they do. And I was going to, bring up the subject of teaching her to do it for him. Because that's what we're there for. We're not there to be there forever. We're just there to, get them to be functional and independent. So, Kind of needed her, but whatever. She left. I figured she'd be back. So I'm going and I'm doing my thing, reading over papers, doing my assessment, checking all his medications, checking on his pain, doing my nursing thing, and I get to the wound care part, and so I said, well, being as though the location is where it is, it's not really something you can do yourself. Do you think we can talk to your wife about teaching her? And he gets a little nervous, and he's like, oh, I thought you guys were going to come out every day and do this. So I said, no, don't worry. We'll make sure that your wound is taken care of. We given a limited time by the insurance company. So I just wanted to, have your wife watching me at least, so that eventually she'll be able to take over when we're not here anymore. Because sometimes these things may take a while to heal, and the insurance company wants you to be able to have a family member or do it yourself. So, nothing imminent that she has to learn right now, and I'm not coming back, anything like that. So he's okay with that, but he's like, I don't know. Getting set up. I'm about to check out the wound. Wife comes back, and so I'm like, this is my opportunity. I want to bring it up at least and see if she's for it or what's the deal. So I give my speech to her about learning it, and she's like, oh no, I'm not doing that. And she's like, and feel free to not be gentle yourself. So I thought that was a weird thing for, a wife to say. Feel free not to be gentle. So I could take it. They're not on the best of terms right now. Whatever, not my business. I'm moving on. I'm doing my thing. And so, I look at his wound. It's pretty extensive. I'm not going to go into details because that would be gross. I'm setting up. I'm checking his wound. I'm getting prepared to do it, but I see how bad this wound is. And I'm like, what in the world? I know he had surgery, so some kind of surgical procedure done. So I just took a little look into the hospital records to see what other information I could find out while I was still there and setting up, just to see how the wound came about. Well, these records said, foreign object lodged in anus upon emergency room, whatever, visit. So, okay, whatever. Foreign object lodged in anus, surgically removed, surgical perforation. Basically, it, perforated something up there. He had to have it surgically repaired, and that brings us to today. So, the wife, I'm doing the wound care. I finish it. I order supplies. I do everything I need to do to finish that visit. I'm on my way out, and I decided to ask the wife a little bit more about what her involvement I could expect to be, or is this going to be a case where I'm really going to have to come every day for the long haul. So the wife comes back. We start talking. She's standing in the doorway. She says, no, ma'am, I will not be, learning anything and changing anything. And if he needs somebody to change his wound, then let his new wife do it. And she points to the chair in the bed with him. She said, obviously that chair has been looking good to him, so he can just sleep with it for the next 10 years. She said, I've been sleeping with him for the last 10 years, but obviously that chair is looking good to him, so he can just sleep with it for the next 10 years. And so, putting two and two together, I surmised that The foreign object lodged into his anus in the emergency room had a lot to do with the broken leg off of the chair. So he apparently broke off the leg of the chair, used it, it got stuck, it perforated something, and caused a whole lot of problems in his life since then. So that was my story, the new wife. Just some follow-up on that. I ended up seeing that man every day for a few weeks. His wife did eventually, not the new wife, but the original one. She eventually came around to learning how to take care of it. She did. She went on to take care of it. I discharged him, and it was doing better by the time I discharged him, about a month or two later, and that's pretty much all I see of them until they're discharged. So I'm assuming that everything went well for them after that. So that was pretty recent, actually. It was like 2 years ago. So my next story is it's not really a funny story at all. It's a bit of a sad story. Not too sad, but yeah, actually it is sad. Excuse me 1 second. The next story was on home care case. I got the patient information. I do my normal thing. I call them, schedule a time, come see him. So it was a young guy, not a great neighborhood. But I spoke to him, told him I was coming, told him what time. We set it up. I show up, knocking on the door, no answer. I'm hearing a baby inside, so I'm figuring out maybe, he can't hear me over the baby, so I'm waiting, and I'm kind of waiting for, when the baby stops crying or whatever, then I'll knock really quick in between cries, because the worse than leaving, and then, it was all a misunderstanding, and they need you, so you have to drive back, and so it was worth it to just wait it out and try to get them to open the door. So I'm knocking, I'm calling from the door. Eventually, somebody from an upstairs apartment came down, and I obviously woke him up because he wasn't happy. And he says to me, oh my God, what was all this knocking? I explained, though, I'm just here to see whoever, this guy, and just waiting for him to open the door. I hear their baby, so I'm pretty sure somebody's in there, and I want to just leave. So he's like, all right. So he was like, he starts banging like extremely loud. Nobody comes to the door. Baby's screaming louder than ever. So then we're both like, okay, we can't just leave with the baby screaming now, because now we're worried. So he's like, I might still have their key. I'll be right back. So he goes upstairs to his apartment. He was apparently friends with the guy, or maybe a landlord or something. I don't know. And he gets his key, and he comes back, and he opens the door. Now, going into this, I did know there was some kind of sketchiness with this patient. But whatever. By sketchiness, I mean, what I was there to treat was like a drug-related injury. I guess that's the best way to say it. So, he opens the door. The patient is laying on the couch, needle in his arm, out, unconscious. 5 feet away on the floor is the patient's girlfriend, wife, whatever, laying on the ground, needle in her arm, unconscious. Baby's in the playpen, screaming. Now, I know that it was literally 20, 30 minutes before that moment and I last spoke with him, because I called him asking to come to him next. And so he said yes. So wherever I was leaving from, that all I did was drive there. So it wasn't a lot of time. So, the plastic. So, both of them unconscious. Baby on the playpen. So, I tell the neighbor, grab the baby, take her in another room. She's like not talking age yet. I would say under 2. So I said, take the baby in the other room, but do not leave, please. I'm calling, and I'm on the phone with 911. The second he opened the door, I grabbed my phone. I was dialing 911. Pulling out the needle. Checking pulses. They're both breathing. They both still have a pulse. I mean, it was really weird, but 911 came, several ambulances, got them off to whatever hospital and emergency room, and that was it. I guess he felt like, I had to attend to a drug-related injury with him, which was like a wound from an infected IV shooting up site, and I guess he wanted to get a quick fix. Before I got there, so him and the wife, apparently, so hopefully they got some help, but I never had any follow-up information about that couple or that family. The baby was turned over to the police, and they came, and that was that. So my next story is called Still Attached. This was, I'm trying to think. This was actually not a home care story. This was emergency room story. And so the beginning was knowledge we learned after the fact from the first responders and paramedics that entered the house. So they responded to a call to someone's house, and I think the man was complaining he couldn't get up or something like that, or he had fallen trying to get up. So it was a young guy, I would say maybe 40s, and this was a really long time ago. This was right out of nursing school for me, so I'm gonna say 1990 something, 95, 6, somewhere around there. And so the hospital emergency room got the call. Ambulance is coming in, bringing a morbidly obese gentleman who had fallen, and that's why he was coming in. So that's pretty much all we knew over the radio. Now, when he got there, the man was really, really big. They put him on a gurney, transferred him to the gurney, to the ER gurney. And I noticed he was still sitting on the cushion from must have been his couch at home. So I was like confused. He falling, trying to get up. They bring him in with the cushion still under him. Okay. And even stranger than that, he had like a plastic grocery bag tied around his head. Okay, so the paramedic says to, us in the emergency room, has a head wound. Please be careful with that one. And then he smirks and moves on. And then he writes his note, and he goes out and talks to whoever, the doctor, the other nurses. I was busy in there, getting the patient set up, vital signs, things like that. We go to turn a patient over. We're trying to adjust sheets and whatever. And we roll this man over, and I realized that he's still attached to the couch cushion. What I mean by attached is he must have been sitting in that one spot for so long and soiling himself, sitting, never moving. Between the moisture from sweat, urine, feces, whatever, or from all that moisture and sitting in that one spot for so long, the couch cushion fabric literally was inside the man's skin. Like his skin had grown over it, and it was literally inside him. So they just cut out a piece around it, and they had to send everything with him to the emergency room. So he came literally still attached to the cushion. So the doctors are, or nurses, and everybody's cutting away at things, and they know that this is extensive and it's going to have to be done under anesthesia. So they're like, okay, we heard you had a head wound, we need to check it out. They take off the bag. He's like, yeah, it tingles a lot. I didn't even know it was a wound. I just thought it was tingly. And we just insert a quick disclaimer here. The rest of the story is not for the squeamish at all. If you don't want to, hear anything considered gross, please don't listen. So they removed the plastic bag, and literally maggots were falling out of his head. They were everywhere. So I guess the first responders just put the bag over to tie it around to keep them from falling out all over the ambulance. They didn't want it all over the ambulance, and they were just trying to, contain it until it could be looked at. So they pulled the bag off. They put his head over a basin. They're all falling out in the basin. We're spraying and trying to clean the head wound. I swear, I think I itched for days after that, even thinking about it. And that young man ended up staying for a while with extensive wounds, and he went to a rehab facility where they had to surgically remove the couch from him, and then he had extensive wounds needing inpatient care. So he stayed at a nursing rehab facility for a month to get his wounds under control, because there's no way he could do it himself, and he only lived with his elderly parents who really could not learn it and help him. So he ended up staying for that. the sweetest guy. It was just a shame that that had to happen to him. So that was that one. I think I have another one. My next story, what actually happened in school as a student 21 and a half years ago. 22 years ago. Oh, my voice is hurting so bad. I swear I am coughing every 5 minutes. I'm going to need to do a hell of a lot of editing because of that. I am going to have to rest up my voice a little bit. I'm supposed to go back to work tomorrow, but I'm going to have to rest up my voice a little bit. I should not have been filming a video that requires so much talking. But I got one more story just for this video, and I will try to get through it. So, nursing student, psychiatric rotation, major hospital lock unit. These are all the people that have been 302'd, which is involuntarily committed because they are a safety concern for themselves or others. And so there were several groups of students from different schools, because this is a teaching hospital, that were there. So we ran into a lot of different students, and we tended to not wear uniforms, because in the psych unit it intimidates the patients, and they just prefer everybody be in street clothes. Everybody be in street clothes with just, like our little school ID, or the employees wear their work IDs. So we were like in groups. We didn't do much for these patients. We were assigned a patient, and we would sort of just do activities with that patient, attend their group sessions, read their chart, go back to our conference afterwards and discuss different things and treatment plans and stuff like that. That was all to the psychiatric rotation. So, like I said, there was plenty of other students from other schools there. We were constantly bumping into people and sharing stories and talking. So, I'm doing crafts with my patient and another young guy who was like younger than me, maybe, at the time I was literally 24, something like that, 24. This guy was maybe 21. He said, "Oh, hey, I'm from whatever hospital." They have their own students as well. Their hospital is a part of a school that had their own students there as well. So, I thought he was another student there from that school. And he just introduced himself, and yeah, I'm from such and such a hospital. How's it going? He's asking questions, and I'm just asking him questions, and we're just having a conversation. And, I'm about to go attend group session, and he starts talking about the field of psychiatry, and he's like, sounds really, really educated to be so young. But he starts going on about psychiatry and meds and treatment plans, and this field is so interesting to him. And I just thought, a lot of male nurses at that time were going into psych, And I thought, he was just a student interested in psych, and that would probably be his field of interest. And so we we had a conversation about it. I went to group with my patient, and that was it. And so later, we were at post conference, which is what they call when we meet up, all the students from your class meet up at the end of the day and discuss your day. So we were at post conference, and we were talking about our experiences for the day. And I mentioned, all the other students, the other student that I met. And everybody was like, we were the only students here today. Like, no. It was a guy, he was a student, and I described him. And my classmates were like, my one classmate was like, oh, that was, so-and-so. Yeah, he was my patient. I'm like, what? Your patient? And so she's like, yeah. And, and then she went on to describe him again to make sure we were talking about the same person. We definitely were talking about the same person. And I'm like, oh my gosh, he's a patient. So she's like, yeah, they found him. He was a student here. And, he just must have had some type of psychotic break. And they found him in his dorm bathroom, sitting on the ground eating his feces. And I thought, it's amazing how, you would, I would have never guessed that had she not been right there and described him exactly down to, the clothes he was wearing. I would have never known. I just thought he was a student just like us, and he was a student just like us. Actually, he wasn't a nursing student, but he was a student in the college of the hospital we were working at. And this all happened, and they had to, he got diagnosed with something, major that I'm sure changed his life, and will, need to take medication for, and hopefully get under control. But I always said there's a fine line between genius and insanity. But that was like a situation that really shocked me. But a nice young man. He was gone by the next time we did a rotation there. We did it on a weekly basis. So by the next week, I was looking to see whatever happened to him, but he was long gone at that time. So I think I got through all my U's and all my V's, and I did not get much accomplished, but because I had to stop every 5 minutes to cough. What I'll do is I will do a part 2 to this, and I will get through a lot more of my painting and a lot more of my stories. And if anybody don't want to hear me yapping about stories, just tell me and I'll shut up. But this is going to be some beautiful picture here. So I cannot wait to see how it turns out. I think the next letter I'm going to do is I'm going to do these, which are infamous 310s, and it's a lot. All of this, all of that. I'm going to come back for part 2, drink some tea, try to get my voice under control, go pick up my children from school, come back with my coffee, sit down for part 2, and so that'll be out shortly. But anybody that stuck around through my horrible voice and my horrible stories, and you diamond painted with me, I really appreciate it. And thanks for watching and hanging out with me. And hopefully I'll do more of these videos. And stick around for part 2. See you soon.